to perform the procedure and actually at the same time record it. We train ear professionals around the world internationally in the procedure, and if you're in the UK and you're suffering from a blocked ear, feel free to visit our website www.clearwax.co.uk. You can enter your postcode or your city, town, and you'll then on the screen have a list of all your nearest specialists, earwax removal clinical ear care specialists, who you can then contact and arrange your appointment. So we have a client here. He attended with the primary complaint was his left ear, which is the ear that we're in at the moment. And you can see the earwax is very soft, loose, wet, very mushy. Whenever I see earwax like this, I always ask the patient, had they been using hydrogen peroxide drops? I find that hydrogen peroxide drops turns the wax into a mushy consistency, almost like mashed potato. Sodium bicarbonate earwax drops turns the wax very molten, very liquidy, and olive oil soaked earwax, it kind of binds the wax together. I always compare olive oil to an egg in a potato cake or fish cake mixture. It binds the ingredients together. So I immediately knew the patient had been using Otex just by the consistency of the earwax, and it just makes it quite difficult to suction. It keeps blocking the suction probe. Can't really use any other instruments. You can't use forceps because the wax is too mushy. An ear hook will just slice through this wax because it is a bit too loose and wet. And similarly with the Jobson horn, there is wax on the eardrum as well. So a Jobson horn, you can't remove wax off the eardrum with a Jobson horn, because the idea of a Jobson horn or an ear hook is to get in behind the wax, and to remove this off the eardrum would have to scrape it off the eardrum, which would be very uncomfortable. So we just have to persevere with suction here. And whenever I perform a procedure, it was a question I got asked, and it was a good question. Some of you may have noticed that I always try and aim for the main blockage. So there's wax around the edge. So I always try to, my first port of call is to try to relieve the patient of their symptoms, because the wax around the edge of the ear canal, it's not so important if you don't remove it, because that's not going to affect their hearing. So you will notice that I always go kind of in the middle, deep, trying to tunnel through the wax so I can see the eardrum. Once I can see the eardrum, then I know some of the patient's symptoms have been alleviated, and then I can always then go around and mop up if it's clinically required. The only time where I would start off around the edge is if you've got someone with dead skin, or I know if I remove this piece of wax on the side of the ear canal, it's also going to help remove the main blockage. With this type of procedure, it's not the case, because the wax is very mushy, very wet. It's more superficial around the edge. It's more aesthetics really if I remove it. It's not causing a blockage. So you can see I'm really going towards the eardrum. So that's a very good question actually, and I hope that kind of explains it. First and foremost, as a clinical ear care specialist, we just want to alleviate the patient of their symptoms, and even if I can create a little gap in this wax and we can see the eardrum, it will provide the patient with a tremendous amount of relief. And even if we can't remove the rest of the wax, at least we know the patient's going to go away hearing better. So this is that remainder piece of wax, as I mentioned earlier, that's really impacted on the eardrum. What the patient had also been doing, and a lot of people do it actually, because I don't think it really explains it very well in the instructions, but after using the hydrogen peroxide drops, the patient just lay on his side, fell asleep on that ear. So this drops was kind of turning the wax very mushy, and it was also causing the wax to drizzle further down the ear canal to settle on the eardrum. So whenever I advise patients to use eardrops, I advise the patient to let it soak for 5 or 10 minutes. So the ear that you put in the drops in, have that facing the ceiling, and really be generous. Put the drops in, really fill up your ear, and let it soak for about 5 or 10 minutes. And then after that, very, very importantly, tilt your head the opposite way. So the ear that had the drops in is now facing the floor, and you just put a tissue underneath your ear to kind of drain and collect all those drops. If you've got a very narrow entrance of your ear canal, you can pull your ear back so it opens up the ear canal and then put the drops in. And again, when you're draining your ear, make sure you pull your ear back so it allows the ear to drain. Don't perform that procedure in the opposite ear, so the contralaterally, the opposite ear, the same night, because when it comes to draining the second ear, some of the oil might seep back into the first ear. So that's just a good little tip. And when you drain your ear, you're kind of making sure this wax and all the drops is coming away from the eardrum and laterally out of the ear canal. So you can still just put a fine end here, just going onto the eardrum, but I'm just not getting anywhere. It's not vacuuming, it's too thick. As I alluded to earlier, there's no other instrument. Can't use forceps, can't use ear hooks, can't use Jobson horns. So in a moment, I'm going to put some more drops in. And I had an email from a specialist in America, kind of asking me how often do I use eardrops? And I said I use it quite regularly. And if you watch my videos, you'll probably see I've not counted it, but I would guesstimate about 50% of my procedures I would use drops. And in procedures like this, don't be afraid to use it multiple times. Do it layer by layer. So that outer layer, the drops help soften that outer layer. So I'm using olive oil, so it binded the wax, and you'll see the effect of the olive oil in a moment. It will really bind this wax together. And after I was able to clear that more lateral wax near the entrance, I just put another layer of drops in to soak and penetrate against this. And you can see how it's binding it together. That's coming out in chunks now. With this patient as well, he had a very narrow ear canal entrance. It's something I should have mentioned at the beginning. So we're having to open up his ear canal a bit. And you can see it's a bit blurry there, so I'm just coming out. We need to be sure we can see exactly what we're doing. So if it is a bit too blurry, you always need to come out and just give the tip of the endoscope a bit of a wipe. And we're right on the eardrum here, so you can see the inferior, so the bottom part of the eardrum, and majority of the posterior is the back part. So we call that medically the posterior inferior quadrant, and I'm just releasing the more anterior wax. Anterior is the wax to the front of the eardrum, so in this case to the left, and it's stuck in that anterior recess. So the anterior recess is a little hidden ridge, a little cave to the front part of the ear canal near the eardrum, and you quite often get wax trapped in there. We're just going to delicately lift this away. So it's got a bit blurry, so again I've just come back out. I want to make sure we can see what I'm doing, and I've just gone back in with the full size ulnar suction. I just thought a bit of suction. You can see this has just come out so nicely in a plug, and the olive oil has really helped to do that. And look at that, all clear. When I started that procedure, I didn't think his ear would be as clean as that after we'd finished, but the oil really helped. So this is the patient's right ear. It's just some non-occluding lateral wax near the entrance. See the whole eardrum. Because I've been using the suction probe, I just thought I'd quickly just get this out. The ear canal again, it's very narrow, very slit at the entrance. This wax is a lot drier. The patient hadn't been using drops. Obviously the patient hadn't had any symptoms in this ear, but as he was here, I thought I'd just get it out for him. And just this final bit at the bottom, it's slightly adhered. It's more fudge type of wax here. I'm just lifting that. You can see the skin adhesions, that's all out. So the ear canal is completely clear. We're just going to mop up this the entrance now. Just a bit of dry skin. So I'm just hovering over with the suction probe. Brilliant, all done. So I hope you enjoyed that video, guys. I hope wherever you are in the world watching this, you're keeping well and safe. And stay tuned. If you're watching on YouTube, please do subscribe.